Good morning, everyone, and welcome to Medical Grand Rounds. So this is our Grand Rounds that's sponsored by, so I want to thank the Rochester General Hospital Association. They've been, this is the fourth decade now that they've been sponsoring these professorships and have enabled us to bring in a who's who list of speakers for local grand rounds. So this is really a great program. I do miss the in-person part of this program where an intimate group could get together the evening before for dinner and we would get to know the speaker a little better. But this is the first one that we're doing since the COVID pandemic. And we've chosen to, I mean, we don't know how long this is going to go on. So we're going to try to do them in this way. It's a little bit of an experiment, but I think it's better than not doing them at all. So I'm very pleased today to have Dr. David Stukus. I want to thank Dr. Shahzad Mustafa for his introduction to Dr. Stukus and for actually making the invitation. So thank you, Dr. Mustafa. It's an honor and pleasure for us to have Dr. Stukus with us. This morning, Dr. Stukus went to medical school, undergraduate and medical school actually at the University of Pittsburgh, then went on to Columbus to do his pediatric residency. There was a brief stint at the Cleveland Clinic where he did his allergy and immunology fellowship. And then about a decade ago, came back to Columbus to be faculty in pediatric allergy and immunology, where he's now currently associate professor at Ohio State. His clinical interest and focus has been on asthma, pediatric asthma, but he's also had this very strong interest in social media and its influence on medical decision making. You've all been witness to that in the recent past, more so. So his topic today is impact of social media misinformation on medical decision making. So with that, I'm going to stop sharing and I'll ask Dr. Stukus to share his slides. And without further ado, hand over the podium to him. Dr. Stukus.
Oh, thank you very much for the very kind introduction. I'm also, I miss the in-person interactions as well, and I'm honored to be the first guest in this format for you. And you know, your division of rheumatology and allergy and immunology at your medical center is top notch, and you have wonderful resources and allergists there, and it's a privilege to be here today. I understand that this topic is very timely for your community as well, which is rather interesting. But as you're going to see as we talk about this morning, and hopefully everybody's comfortable and you have your cup of coffee, this is, you know, what I'm going to try to do today is really give you some framework of what we're up against, frankly, and then ideally give you some tools that we can all fight back because we're all part of this together. This is the world that we live in now. I'll count on you to interrupt if you can't see me advance my slides, but it looks like everything's working okay. So here are my disclosures, which are not relevant. And this is what we're going to talk about. We're going to talk about the sources of misinformation, how we can discuss this with our patients, and then really talk about how all of this influences, you know, the way people make decisions about their health and medicine and things like that, us included as well. So I've given variations of this talk, and actually I was honored to give the first Grand Rounds presentation at our institution after a 2-month hiatus. For that Grand Rounds, I gave it in person in our auditorium, and they recorded it for everybody to watch virtually. For that one, I actually had shorts on. So I just wanted to let all of you know that I've given you the same exact honor as well that I gave our institution. But as we go through this pandemic, did you ever think that this would cause such an uproar? I mean, think about this for a second. As medical professionals, we recognize the importance of public health. We understand basic concepts such as viral transmission, and how we can reduce the spread of various infectious diseases based upon how they're spread from human to human. But a face mask, a simple public health measure that other parts of the world have used for years to help reduce the spread of infectious diseases, has caused such an uproar in the United States and beyond. And it's so remarkable to me to think about, how do we get to this place? Well, we're going to talk about that. I'm sure you've heard the term fake news. I'm sure you've heard the term infodemic. It's interesting. I'll show you a little bit later. About 12 months ago, the World Health Organization actually already declared that with COVID-19, it's an infodemic. We're just getting so much information from so many different sources, and it's misinformation and disinformation, and it makes your head spin. And it really has blown out of control during this pandemic. But this has always been going on. We all know this. It's just we had different targets. And I've spent a lot of time on social media over the last 7 or 8 years, really trying to understand some of these sources and how that influences medical decision making. In the world of allergies and food allergy in particular, there's a whole host of misinformation that impacts how people make decisions about diagnosis and testing and things like that. We have 2% of the people that actually feel the earth is flat. Think about that. If you're trying to have a conversation with them in your office and they're a patient of yours, 2% of your patients think the earth is flat. We have people that used to think that 4G technology was some form of mind control. They moved on now to 5G technology, of course. Of course, we have the very organized, very combative anti-vaccine movement, which now is just mobilized unlike any time in history, to really sow doubt on a regular level. We have people talking about big pharma, and we're all shills because we're in the pocket of big pharma. Anytime we recommend things like vaccines or evidence-based standard of care. Of course, the QAnon conspiracy, which it's interesting. My first tussle with the QAnon group on social media occurred about 2 years ago. I had no idea who they were. And it was a very hectic 48 hours of lots of people sharing their opinions with me online. And now, of course, we all know who QAnon are and what they stand for. And then we're up against, alternative medicine practitioners and people who are against things like genetically modified organisms and so on and so forth. Now, with social media, I'm sure many of you are on it right now. We're talking about things like Facebook and Twitter and Instagram and TikTok and things like that. This is just a way that our world interacts with one another in a way that we've never seen before in history. And there's been a lot of sort of interest in social media sort of being regulated and deregulated and what that's doing to society. I just want to point out at this point that if you think about when social media was first, released into the world about a decade ago, they had no idea what it was going to become. They had no idea how it was going to control our lives. They had no idea how it was going to get out of control in regards to how people could weaponize it and monopolize it. The train is off the tracks, folks. But we need to be aware of it. You can hate it, you can love it, you can use it, you cannot use it. But regardless, our patients are using it, and the people that we're interacting with and we're trying to help are using social media, and they're going online to look for health information for themselves and loved ones. We know that at least 3/4 of people search online for information. They're using common search engines. They're taking that information, and a lot of times they're finding misinformation. And they want to hear from experts, but not enough of us are out there engaged in this format. And a couple of years ago, I actually asked my followers on social media, what are you looking for? Why do you want healthcare professionals to be on social media? And these are their words. These are some of the things they said back. They said, we're seen as a source of good health information. They have an overall positive view of doctors and healthcare professionals. We offer insight. We're trusted experts. They learn from us. Accessibility. If you have healthcare experts at your fingertips when you log on to Twitter or Instagram or Facebook, that's amazing. That's just the way the world works these days. That's how we get our information. And those healthcare professionals who are engaged in social media are seen as thought leaders and forward thinkers. Now, my journey first started about 8 years ago, and it began from my interest of, understanding misconceptions and myths. I started with some research on this about a decade ago. I put some presentations together for national meetings, really talking through, and it was born from all the common questions I was getting from patients and referring providers of, why are people still worried about egg allergy with the influenza vaccine when that was disproven 7 years ago? Why are people worried about, red dye allergy when it doesn't actually exist? And yet these are the themes that we're hearing over and over and over again. And that's when I decided to actually look at some of these sources of misinformation and say, what is the evidence surrounding it? And for most of these things, like red dye allergy and things like that, there wasn't any evidence at all, or the evidence was very, scarce, and it wasn't robust by any means. And then I did something that changed my career forever. I took the same searches that I put into peer-reviewed sites, and I put them on common search engines. And guess what I found? The information was very different. So whereas PubMed shows that there's actually no peer-reviewed published evidence to support something, if you put the same search term into Google or Yahoo, or whatever you want to use, you're going to see millions and millions and millions of hits telling you the complete opposite information. And that's when I decided to join the fight. So that's when I became @AllergyKidsDoc, first on Twitter. Now I'm on Instagram as well. And what I do is I try to use a social media platform to dispense evidence-based information. This is my profile for Twitter. And really try to combat misinformation the best I can. And I'm not alone. There are thousands of healthcare professionals that are doing this very effectively, but we can use more because this is where people are going to look for information. And really what I see myself trying to do is I try to take not only my understanding of evidence and methodology and research, but really the perspective that I have from all of the patients that I see, and I try to bridge the gap. Because we know that there's the misinformation online. We know what the evidence shows, and we can bridge that gap. And I've had a lot of personal growth from this, just from having these conversations with personal patients in the office setting, with friends and family members and neighbors, and then with all of you as well. And hopefully I'm going to give you some tips that you can use as well. So before we talk about what we can do to help, we're going to go down the rabbit hole. I've been down this rabbit hole many, many times. I encourage you to spend time in the rabbit hole. I encourage you to go down there with your favorite adult beverage or two, because it's a dark place, and it's getting harder and harder to really distinguish the incorrect information from the correct information, because they're getting very good at what they do. A lot of it boils down to differences of how we're viewed as medical professionals. So a lot of times people wait months to come see us. Then we make them wait in the waiting room. Then they wait in the office in their paper gowns. They're cold, they're fidgety. We make them wait for an hour before we walk in. And then we go in and we sit down. We barely introduce ourselves. We don't make eye contact. And we start clicking away at the electronic medical record. That's not a very personal experience. Whereas if they go to either alternative medicine practitioners who will spend an hour with them, just laying hands on them, holding their hand, listening to them, or they'll go online and they'll hear very personal stories. These are things that they feel they're being listened to. They can relate, and people are actually listening to them. Whether they are telling them anything that's of truth or not, it doesn't matter, because they feel valued and they feel heard. And that's one area where there's already a disparity. So we're behind the 8 ball when it comes to this. We, as medical professionals, understand that there is a hierarchy of evidence. A single case report really doesn't change the way we practice, nor should it. However, if you have a systematic meta-analysis that takes the body of evidence and evaluates the quality of that evidence, as we do with clinical guidelines and so on and so forth, that carries much higher weight. We understand that. A lot of the general public do not, and our patients included. So they go online and they see a very convincing YouTube video. And they say, oh, it's online, it must be true. They read somebody's blog. They see somebody putting things out on social media. They see interviews and things like that. And they don't understand the difference. So we can bridge that gap and talk to people about why evidence really matters. And more importantly, the quality of evidence. If I had a nickel for every time somebody threw a study done in mice in my face showing benefit for some alternative, approach to testing or treatment or things like that, I'd be a pretty rich person. But humans are not mice. And mice data are important to help give us an idea of, would this be something that's plausible in humans, but we really need to rely on that. So that's one example. Another area that I've taken a deep dive over the last few years is really understanding our cognitive biases. And we all have these. These impact the way that we actually treat the patients that are in front of us, because we rely upon our own experiences and we say, oh, that one patient 10 years ago, they had a similar story and they did this. Therefore, maybe I should do this with this patient. This is happening with our patients all the time. And if the more we understand cognitive bias, the better we can help them. In my world, a lot of times recency bias impacts families living with food allergy. They may have a history of peanut allergy, perhaps their child had anaphylaxis, but it's been years and years and years. They're going to restaurants, they're going to school, they're playing sports, they're doing absolutely fine. But all of a sudden, they see a scary post on social media, or they watch a documentary that says, "Oh, my child with peanut allergy, touched something at the playground, and they had a near life-threatening allergic reaction." And then just because they happen to read that article, just because they happen to watch that documentary, all of a sudden now they don't want to let their child go to the playground. They're reluctant to send them to school. They no longer eat at the restaurants that they were eating at on a regular basis. So this is just one example of recency bias where people take the most recent information and really apply unequal weight to that. But there's all kinds of different ones. Now, one of the things that impacts all of us when we go online is confirmation bias. We all have beliefs and ideologies, and we like to think that we're right. I mean, it's really hard to walk through, our daily lives thinking that we're wrong all the time. And when we encounter information that confirms our beliefs, regardless if that information is correct or not, we're more likely going to take that in and say, there you go. See, that confirms exactly what I believed before. Whereas if you find information that counters your beliefs, are you actually willing to accept that? And we'll talk about echo chambers in just a second. So when our patients are going online looking for information, same with us, they're already going online knowing what they're looking for. And they're more likely going to believe the things that already confirm that and refute the things that don't. So we need to be prepared for that when we have these conversations with them. And then we have pseudoscience. So pseudoscience is everywhere. The more you recognize it, the more you will see it everywhere. It's in celebrity testimonials. It's in, very popular blog posts and websites that have millions and millions of visitors. I put this together because these are just some of the buzzwords. When you see these buzzwords, you will recognize, aha, I see what they're doing here. It's a pseudoscientific approach to try to, explain things and get people to believe it. Inflammation is the hot topic. As an allergist and immunologist, and many of you as well, we know that inflammation is not one size fits all. What type of inflammation is it? Is it allergic inflammation? Is it non-allergic inflammation? What's the pathway of inflammation? Is inflammation good? Is inflammation bad? But people will use this term and just say, oh, we need to stop eating these inflammatory foods in our diet because it's causing memory loss and sexual dysfunction and fatigue and dry skin and you name it. Free radicals, detoxes and cleanses. Celery juice was a thing for a while because it was actually brought up by a medical medium because the spirits told this person who actually had no medical experience that if you take celery and you turn it into a juice, you can release its magical properties. It can heal all that ails humanity. I'm not making this up, folks. These are just some things that you can look at. So learn these. When you see them online, you will recognize them. And now you can actually address them with patients in the office or friends or neighbors or family members and say, listen, they're trying to use these buzzwords to catch your attention. These are marketing terms. Another big one, of course, that we deal with, and the folks in allergy in your group as well, boosting immunity. It's a marketing term. As immunologists, we don't tell our patients, go eat some blueberries to boost your immunity. That's ridiculous. If you want to boost your immunity, get a vaccine. That's the only way to do it. Here's one example I like to share. So Himalayan salt lamps are all the rage. It started from people going to salt caves for centuries. And it was people with chronic respiratory issues, probably who either had sinus conditions or they had COPD, or not COPD, of course, because centuries ago, but whatever it was. You go inside a salt cave and there's increased humidity and probably some salt in the air and things like that. And you have this osmolar effect, and then you can expectorate more phlegm. So that's been extrapolated. And they say, well, if you go inside a salt cave, which is one thing, what if we capture that magic and we put it and we take a piece of the salt? And what if we actually put a little light inside of it and then light it up? And then we can sell it at Bed Bath & Beyond for $29.99. And then we can claim that it treats all kinds of respiratory issues. And if you look at some of the explanations, it says they're actually rock crystals. And they start talking about negative ions. And of course, we're all surrounded by ions, some of them from outer space. And of course, do you ever feel refreshed after a storm? Well, it's probably because of those negative ions that are emitted. And then, of course, they go through and talk about, well, let's talk about asthma, because the main culprit of asthma lies in everything that dances around us, including allergens and viruses. And the Himalayan salt lamps will actually attract those and get them out of your body and therefore purify you. And then all these specific claims like improving blood flow and circulation, energy levels, and helps us sleep better. So this is everywhere. This is one example. I hope everybody who's watching right now recognizes all of the pseudoscience and BS behind this. But if you have low health literacy and if you're looking for a relatively inexpensive way to maybe help your asthma, I can see why this would be appealing. And then, of course, we have the personal stories and anecdotes. Now, anecdotes are, this is what happened to me, or this is what happened to a loved one. Therefore, everybody else should do it this way. Well, it can be good. It can raise awareness for rare conditions. It's relatable, and people would say, oh yeah, you know what? I have that condition. That makes sense. And maybe we can, advocate together. It can, help people maybe go down a certain path, but it can be bad as well, because this is where all the biases come into play. We have no way of knowing whether that person's story is actually true or not. Also, people tend to neglect certain details. They don't do it on purpose necessarily, but they say, you know what? I was feeling very poorly. I took gluten out of my diet, and then I started feeling better. Well, by that point, you're already invested. You already have the placebo or nocebo effect in full effect, thinking that if I do this, it's going to make me feel better. And you may also be neglecting important parts like, while I took gluten out of my diet, I also started exercising more. I reduced my alcohol intake, and then I started sleeping better at night. But in their mind, because they had fixated on gluten, that's what they think it was. So there's a lot of issues, and we can't extrapolate anybody's personal story to anybody else, really. And that goes for all of us as well, with our own experiences with individual patients. Just because something happened with that one individual in front of you before, they may have important details or nuances that don't actually pertain to any of your other patients, even if they have similar diagnoses. This is one example of the anecdotes. So urine therapy is a thing, and it has been for a while. And this is one person who said, I've been doing urine drops in my eyes and holding a glass of urine over my eyes for short durations. Now they're getting red and pussy. I was wondering if anyone else went through this. And one person had no hesitation chiming in. Yeah, it's called a detox. Keep doing it with fresh urine and it will get better. So people, you go online for information and this is what you find. And then, of course, we have the very common error, especially in media headlines, of people mistake correlation with causation. This is a very important distinction. We can talk to our patients about this, and we can say, just because two things are associated does not mean that one actually caused the other. These are very different things. If you're interested in a good chuckle, one of my favorite websites is Spurious Correlations, where they go through and they can correlate all kinds of things. This is one example. You can correlate the per capita cheese consumption with the number of people who died by becoming tangled in their bed sheets. It looks pretty good to me, so therefore it must mean that if you eat more cheese, you have increased risk of dying because you get tangled in your bed sheets. One I use in the food allergy world is we've seen a dramatic rise in the prevalence of food allergy over the last couple of decades, and people have all kinds of reasons why they think that's happening. We don't have good answers. But I also say, well, the rise in food allergy prevalence correlates perfectly with the day that Justin Bieber was born. And then people kind of look at me funny and say, see, there's correlation, it's not causation, unless we can say the Biebs caused food allergy, but I don't think we can. And then this is one example of an exchange online, people saying there's no evidence except for all the moms on this page saying that their kids got allergies after being vaccinated. What a, quote, coincidence. People really don't understand this important distinction. And then, of course, we have people who are doing their research. And how many times have you heard this? I'm sure we've even said this. I've done my own research. Well, what research looks like in 2021 are we have our preconceived notions. I've already mentioned confirmation bias and cognitive biases and things like that. And we have our beliefs. And we say, I'm going to go online and I'm going to look this up. I'm going to research this myself. I'm going to spend 15 whole minutes looking at this. And you'll go to social media, you'll see anecdotes, you'll go to websites and find misinformation, you'll find echo chambers, things like that. And then you focus on all the information that supports your beliefs. You'll cherry pick the data that says this is why we need to do it and ignore the opposing data. This is what constitutes research these days. So again, this is what we're up against. And then one of the more frightful aspects of social media when it comes to misinformation and health information are people are now empowered. And they feel that just because I've done my research for 15 minutes, I now have the capability to actually offer recommendations to others, even though I actually have no training whatsoever or expertise. We're seeing tragic examples. This was a year ago. This was a mother who didn't really believe in vaccines. She took her son at the time to see his pediatrician, and he had influenza. Pediatrician recommended treating with Tamiflu. She went online to her social media support groups, and this is, she said, I'm looking for other cures and information. What can you help me with? And they came in with all kinds of advice, such as giving him breast milk, he's 9, thyme and elderberry, all kinds of different things. And she did not give him the Tamiflu. She tried some of these other therapies, and this poor boy tragically died. Now, we have no way of knowing whether the Tamiflu would have saved his life or not, but this just highlights what's happening on a regular basis online, especially in social media support groups. People feel empowered to give any kind of information they want, and people trust them. They've never met them before. Oftentimes they're anonymous accounts, but they are trusting complete strangers and they're not even calling us. Or worse, they're coming to see us and they're ignoring what we recommend. And they go online to Facebook and Twitter and things like that instead, and they're trusting the information they get there. That's a real problem. I don't have an easy solution, unfortunately, but I want you to be aware of it. Now, this is where we talk about echo chambers and then this concept of epistemic bubbles. So we all belong in echo chambers. We like to congregate with people that believe what we believe. It's a more comfortable conversation. And in fact, for all of us right now, unless you spend equal amounts of time online every day getting your news information from left-wing sources and right-wing sources, then you are already subscribing to your own little echo chambers or epistemic bubbles. But there's a big difference. What happens when you expose them to evidence? Well, for people in an epistemic bubble that are like-minded, they're just not aware of the alternate viewpoint. They're not aware that there's other evidence that refutes their beliefs. If you share the evidence with them, they say, oh, wow, thank you very much. I'm going to actually take this and I'm going to think about how this actually integrates with what I believe. Whereas in an echo chamber, they say, no, 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 no. Conspiracy, it doesn't belong here. We're going to refute it. In fact, we're not just going to refute it. We're going to fight back because how dare you tell me that I'm wrong? Who are you to tell me that? These are very different things, but these echo chambers are very loud. We're seeing very prominent, very scary examples of how this actually influences behavior on a national level and can, incite violence in many ways. And then going back to the anti-vaccine movement, I want you all to be aware that they're very good at what they do. They know how to target support groups. They go after diagnoses or conditions that have no known cause, that have no known cure. We're seeing this in the food allergy community. Well, maybe it's because of the vaccines your child got. And then they'll throw in some false information about how peanut oil was used in vaccines or is used in vaccines, which actually has never been the case. Or they'll cherry pick data and things like that. So they're sowing doubts. And vaccine hesitancy was listed as one of the top 10 health problems affecting the world by the World Health Organization last year. So this is what's happening on a regular basis. Of course, we have just flat out science denialism. 4 years ago now, I took part in the March for Science in downtown Columbus. Why did we have to march for science? Because people are actually saying that science is not real. It's fake news. And we're seeing this time and time again throughout this pandemic. These are a couple of the signs here. I like this so bad, even introverts are here. So there are people that are just actively refuting science. And we can acknowledge that. And the way I talk about it with people is I say, listen, science doesn't give us definitive answers, but that's not what it's supposed to do. Science gives us a standardized way of answering questions. It helps try to control for as much as we possibly can. It helps understand the methodology. It helps understand the results. And it helps us incorporate a body of evidence to try to see, does that steer our conversation in one direction or another? Science is messy. Science takes a long time. Science often refutes itself, especially when it comes to nutritional recommendations. So if we acknowledge that and try to get people to understand, the scientific method, we may have some breakthrough. And then I hope you're all aware of the deliberate misinformation campaigns online. We're all subject to this. There are different types. So we have bots. Bots are automated software that all they do is they influence algorithms. Every time you go on Twitter or social media and you see something trending, that's being influenced by these automated bots, which are thousands and thousands of fake accounts. They look real, and all they're doing is creating algorithms that will send out the same hashtag or the same topic thousands and thousands of times. And it goes both ways. The only purpose of this is to sow sort of discontent and to get people to get really upset with each other. Then you have trolls. Now, trolls are actually people. Oftentimes they have anonymous accounts. Sometimes they don't. And their sole purpose in life is to actually go into other people's social media feeds and to generate emotion. That's all they're trying to do. So if you ever read something online or if somebody ever comments on something that you posted and the first reaction is for you to say, oh my gosh, how dare they? And you're ready to fire back a reply, that's a troll. You know what we do to trolls? We don't feed them and we ignore them and then they go away. These are bullies. I don't like bullies, but bullies need somebody to pick on. If you ignore a bully, they're going to get bored and they're going to move on. So we can ignore trolls, but we need to recognize what they're trying to do to us. And then we have botnets, which are just networks of all these computer-generated algorithms that are really infiltrating social media. So next time you go online and you see people arguing back and forth on social media, I want you to take a step back and try to recognize, is that an actual person? Is that a bot? And what's actually going on here? So if you're going to try to fight back online, you might be arguing with a computer, which is a waste of everybody's time. But we can also help patients be aware of this and say, oh, that's really interesting information that you're finding online, and then talk about the influence that they may be under. Speaking of, if you haven't watched it yet, this is the scariest movie I think I've ever seen, and it's a documentary. It's called The Social Dilemma. This was released on Netflix about 4 months ago. And this takes a deep dive into those social media algorithms that influence everything that pops into our feed at all times. If you have teenagers at home, and if you have teenagers that have their own social media accounts, I strongly encourage you to watch this with them. We're all subject to this. You and I can put in the same search term in our same search engine online at this exact moment, and we're going to get completely different information back. Because it generates, it knows that the search engines learn what we like to look for. It learns where we click. They learn how long we hover over something before we decide to click on it or not. The manipulation is real, and then they will use that to target ads and things like that. The more we're aware of this, the more we can control how we engage with social media, and especially how we let it influence our lives. There's been a lot of work in this area. I've included these links. I know we shared the slides, which is great. So I encourage you to take a deep dive in this. And now what we're seeing is it's not necessarily devaluing just the expert, it's discarding us. And they're saying, you know what? No, this is my experience. Who are you with your fancy medical degrees and your years of experience? What do you know about my life? This is how I believe things are. It's really a problem of cognition. And then we get back to misinformation during COVID-19. So I mentioned before, we had all these different targets, right? We had 4Gs and GMOs and anti-vaxxers. Well, guess what? Over the last 11 months, there's one target. All of those different fringe elements have taken everything we're experiencing during the COVID-19 pandemic, and that's what their bullseye is now. So now we're getting it from all angles, all at once on one specific target. I don't know if you're aware of something called the CNN effect. This is really fascinating. So when CNN first came on the air about 30 years ago, it was revolutionary. For the first time, we had the birth of 24-hour news networks. But it wasn't just somebody online or on the screen telling us news 24 hours a day. We started getting the scrolls and the tickers, and we have them on the sides, we have them on the bottom of the screen. And then we got the breaking news, in your face, breaking news, breaking news. And now, instead of relying upon newspapers or the morning, afternoon, evening news to give us our information, we get our digestible, bite-sized pieces of information a few times a day. It allows us time to really reflect upon the information we're hearing. We are bombarded at all times by breaking news, breaking news, breaking news. We don't have time to think. We don't have time to put the information in context. We don't have time to vet the information. And the information is changing constantly. This is the world that we live in. And we're seeing it unlike any other time in human history during the pandemic as well. Everything is coming at us nonstop, and nobody has time to catch their breath. This is a huge problem right now in the allergy world in regards to the COVID-19 vaccines. Before the vaccines were even released in the United States of America, there were 2 reports of anaphylactic reactions in the United Kingdom. This was a week before we had the Pfizer one released in the US. The allergy community lost their ever-loving minds. And people were scared out of their minds based on 2 reports. And we've continued to monitor this. Unlike any other time, we have complete transparency in data, it's robust reporting, and we now know that allergic and anaphylactic reactions to both the Pfizer and Moderna vaccines are exceptionally rare. 5 out of 1 million for Pfizer, 2.5 out of 1 million for Moderna. We don't know what the mechanism is. We don't know, what risk factors are. We don't even know if these are actually real. But that didn't stop social media and the online community from speculating. So people are now saying, well, it's because of polyethylene glycol. It must be. Well, before the COVID-19 vaccines, this was recognized as an exceptionally rare allergen. Or people are saying if you have a history of food allergies, you shouldn't get it, and so on and so forth. So this is a real effect. And instead of actually taking time to let science play out, we're seeing media headlines in real time. Think about that. We are seeing this play out in real time every day. And all people see are these scary media headlines, and that's influencing their medical decision-making. I like this cartoon. This was actually about a year ago. So everybody was a constitutional expert during certain goings on in Washington, D.C., and now everybody's an ID expert. And then my favorite word of all time, ultra-crepidarian. Have any of you come across one of these folks in your life? Or any of you an ultra-crepidarian yourself? So this is someone who gives opinions on matters far outside his or her knowledge. The Dunning-Kruger effect. You don't know what you don't know. It doesn't keep you from spouting it. And on social media, especially, it's really interesting because there's a false equivalence. Just because you have an account, or if you have thousands of followers and you're a celebrity, just because you say something doesn't mean it's true. But people don't realize that. They say, oh, that person is verified, or they have tens of thousands of followers. They must know what they're talking about. Well, that's not always the case. Now, during my deep dive in the rabbit hole, I just wanted to share with you some of the ways that this has influenced, our medical decision-making during the pandemic. This was one of the earlier headlines when people were detecting the SARS-CoV-2 in feces and stuff like that. So doctors said, well, maybe it can spread through farts. Therefore, we need to be careful about it, expressing our gas that we do on a regular basis. Of course, we know that that's not the mode of transmission now, but that raised a lot of headlines. I mentioned 4G before. Now everybody's worried about 5G. In fact, people are so worried that 5G towers are spreading the virus that in the United Kingdom, the people actually climb them and they burn down hundreds of 5G towers, disrupting cellular communication because they felt that that was actually spreading the virus. And then Bill Gates has been the target of many conspiracies over the years, but especially during COVID-19. People are saying that this is Bill Gates just pushing out the vaccine so that he can inject all of us with microchips and then undergo mind control and things like that. And you say, why on earth would anybody believe that? And I would say, because 9% of adults living in America believe that the chemtrails in the sky every day left by airplanes, which is normal condensation, those chemtrails are a form of government mind control. 9% of people believe that. I actually just posted this the other day. So it's interesting if you want to talk common sense to anybody, which we'll talk about in a second about why that may not work. If you take a 22 gauge needle that we actually use to deliver a vaccine, the internal diameter is 0.4 millimeters. They actually have microchips and they use these in some areas of the world. This is a viable thing where people can, check out library books or go to the gym or pay memberships or things like that. But if you look at the dimensions of it, it's 2 by 12 millimeters. I have a hard time understanding how this fits inside there, let alone injected in anybody else. And then, of course, people would say, well, it's not the microchips, it's the nanochips, Dave. Come on, man. This may be relevant to what's going on in your community right now. If we think about all of the alternative medicine treatments, and with COVID-19, again, it's all hands on deck. We still don't have a cure. We still really have very limited effective therapies with any evidence to support them. Well, very early on, this was the first report of hydroxychloroquine and azithromycin. This was published in March 20th, 2020. It was a very small study, not randomized. And what they did was they did NP swabs serially every day to see, are they still shedding virus? So the conclusion, despite a small sample size, our survey shows that hydroxychloroquine treatment is significantly associated with viral load reduction disappearance, and it's reinforced by azithromycin. That was on March 20th. On March 22nd and 21st, these were the headlines in Ohio. The governor had to pass emergency restrictions because so many prescriptions for hydroxychloroquine were being sent out that there was actually a shortage. And they equated it to hoarding toilet paper. And this was happening from physicians and medical professionals in our state, but not just in Ohio, across the country. A very small report, and within days, we're seeing people hoard hydroxychloroquine, and people are still touting its benefits, even though we now know there have been meta-analyses and multiple studies all showing the same thing. There is no benefit. We should not be using this for the prevention or treatment of COVID-19. It's not keeping people from shouting from the rooftops that this actually works. And you can apply this same approach to anything. Now it's ivermectin. We've seen all kinds of other things like this as well. But as medical professionals, we can take a step back and say, what's the evidence show? How can we translate that to people to help them understand why the evidence says one thing? And now we have lessons learned. If we don't learn anything from this pandemic, we need to learn in real time how to use this. This is the example we can use about how we started down the wrong path based upon very small reports and conjecture, and how it didn't lead us anywhere we needed to go. And oh, by the way, all those people with chronic conditions that relied upon hydroxychloroquine couldn't get it. So there are downsides to all this as well. And you say, what's the harm in all this? Well, with so much information out there, it dilutes the good stuff. People don't know where to go. Their heads are spinning. They may be more likely to disregard the facts and believe these anecdotes or personal stories. In severe cases, they may forego proven therapies. Why would I undergo chemotherapy for my rare cancer when I can go online and this person says if I go to Mexico for their chelation therapy that they can cure me? It's a lot cheaper and it seems like it works. Spend a lot of money on unproven alternative diagnostic tests and treatment options. It leads to distrust of the actual experts. It can have the wrong diagnosis. Self-diagnosis is incorrect the majority of the time. This happens all the time with people diagnosing themselves as having gluten intolerance or lactose intolerance or various food sensitivities. And really what happens is, and we're seeing this now in real life, especially with COVID-19, we're in the midst where some of us are just living in a different reality. It's an alternate reality where facts don't matter, or they're skewing them for whatever reason. And this is the way people are living their lives. Another example, and I don't want this to be a political talk, but it was, the president of the United States in April came out and publicly said, well, if we use, bleach or disinfectants or maybe UV light shining in the body, that we can, destroy the virus. And when he said that, there are consequences to this. And the consequences were calls to poison control centers went up exponentially in the next 24 to 48 hours. And people actually died because they took his advice and they started drinking disinfectant. There was a man in Arizona, there's a derivative of this. Actually, it was a derivative of hydroxychloroquine, I believe, that is used to clean aquariums. And he ate it, thinking it was going to keep him from getting COVID. These are real ramifications that are happening when we have very public figures stating things that aren't backed by evidence. We're seeing more and more of us fighting back now. There's NPR stories and it's more in the mainstream about how vaccine misinformation especially is influencing medical decision making. So this is what we're up against now. I'm sure you heard the false claims that the Pfizer vaccine can cause infertility. This is pseudoscience 101. People are basically saying that because of certain components of the Pfizer vaccine, it has some relationship to endothelial lining in the uterus, and therefore the body's going to form autoantibody responses against it. It's actually, there's no evidence to support this. It's really high-level stuff, and it's very sophisticated what they're doing. These are active efforts to sow doubt and get people to distrust these vaccines. Just last week, there were people that disrupted vaccine distribution in Los Angeles at Dodger Stadium. They actually halted the distribution because they're against vaccines. And now we're seeing healthcare workers hesitant to get vaccines. This was just from a few weeks ago. And here in Ohio, we had 60% of nursing home staff. The group that we need to target the most to try to save lives with these vaccines, they're refusing to get the vaccine because they're not trusting the information that they're seeing. This is an interesting site. I want to bring this to your attention. So the MIT Review, they've been doing these Delphi surveys in real time on social media to try to get a sense of, are people willing to get the COVID-19 vaccine? And they've mapped it out based upon counties. Well, I took the liberty to actually map this out compared to the recent national election. And what I found was kind of interesting. If you see the darker color means it's more likely to get the vaccine. Darker color here voted for President Joe Biden. The colors match up really well. And this goes along with what we know about face masks. People are tying their ideologies with their medical decision-making. So based upon how they view politics or their personal freedoms or government control, that is influencing their willingness to wear a mask, to adhere to public health measures, and now to get vaccines as well. Here's your county. You guys are doing pretty well, about 80% chance that people are willing to get the COVID-19 vaccine. They haven't updated this in a couple of weeks, but it's something to keep an eye on. All right. Now, as we wrap up here in the last couple of minutes, I encourage all of you to actually spend time online. This is your homework. Put in some common search terms, things that you get questions about from your patients on a regular basis, whatever your specialty is or whatever you deal with on a regular basis, and see what you find. Spend time clicking on the links. Spend time looking for pseudoscience and anecdotes and correlation instead of causation. See if there's evidence to support it. And then arm yourself with that information. Then you can anticipate that with patients in the office and say, if you spend time online, this is what you're likely going to encounter. Here's what the evidence shows. Here's why this may negatively influence your medical decision-making. So hopefully I gave you a sense of all that we're up against. It's a lot. It seems daunting, but we can fight back. This is what I mentioned before. About a year ago, the World Health Organization mentioned it as an infodemic. There's actually great information. This was published in The Lancet, and there's been multiple publications and editorials since then that really give us a nice framework to try to fight back. It goes back to what I said before. We need to get away from this model. We can no longer just treat patients like they're commodities or go in and click boxes. We need to have personal connections with them, and we need to try to relate to them the best we can. And we need to get back towards this model of healthcare where we spend time with them. Shared decision-making is sort of in vogue now, as it should be. And what shared decision-making really comes down to is it really shouldn't be our responsibility to tell patients what they need to do. It should be our responsibility to discuss the evidence and the options supporting them, including risks and benefits. And then we can help patients guide their decision-making based upon their own preferences and values. What's more valuable to you? Do you do you prefer to avoid any potential side effects, or do you prefer to avoid any ER visits and so on and so forth? And then mutually come to a decision about how to proceed. And then you revisit that every time because things can change. life, their life can change, quality of life can change, their decision-making can change as well. This is another great example. It's just published in JAMA in late December, talking about how physicians can deal with all the conspiracies that are going on. And when talking to families and patients and ourselves about, how do you spot misinformation? Take a deep breath, pause, investigate the source. If you can't figure out what it is, or if you clearly see it's like some alternative news site, or it has, ties to political ideologies or things like that, it's probably not vetted, not very reliable. Find better coverage. Can you vet the information? Go back to the actual evidence. It takes time. Critical thinking is hard, but we need to all be critical thinkers. And ultimately, I love this quote: extraordinary claims require extraordinary evidence. So when I see encounter this online, they say, oh yeah, smart guy, well, so-and-so cured my food allergy. I say, that's great. I believe you that you believe that. What's the evidence? If you don't have the evidence to support your claim, it's going to be really hard to extrapolate that and understand it. So as we wrap up here, what can you do when you encounter a conspiracy theorist? Well, you have a couple options. One, you can walk away, or two, you can engage. If you choose to engage, I strongly recommend that you stay calm. Try not to get into a heated debate. People are, they very strongly believe their beliefs, just like you very strongly believe in your beliefs. So who are we to discount their beliefs, whether they're, they have merit or not? Don't dismiss them. Engage in a conversation. Encourage them to critically think through it. Walk me through it. Ask them questions. Well, tell me, how did you get to this point? What led you to believe this? Don't expect immediate results. It takes time. Critical thinking skills are hard to acquire, and it takes practice. And then ultimately, you can't reach everyone. And people always say to me, Dave, why do you waste your time on social media? You're never going to change their minds if they believe in conspiracy theories. And I say, you're absolutely right. I'm not going to reach them, and I don't want to reach them. I'm not going to reach them. There's a group in the middle, and the group in the middle is watching both sides. And the group in the middle can be swayed, and they can make decisions based on evidence, or they can make decisions based on emotions. That's the group I'm trying to reach. This quote as well, of course, if you start to get into an argument or a shouting match, or your emotions run high when you're arguing with somebody like a conspiracy theorist, just keep in mind that you both get dirty and the pig always wins. So sometimes you just have to walk away, and that's okay too. So what can we do now for all of you today, starting right now? You start thinking like a patient. It's really hard to do. I had this conversation with my wife. She's an ER physician, and I do a lot of work with the COVID-19 task force at our institution and with some of our national organizations. And I've just been divulging this information and evidence for the last 11 months. So I'm in it, but I need to take a step back and recognize that not everybody has that same level of understanding of what's out there. Not everybody has the same level of understanding in regards to what constitutes quality evidence. And not everybody understands just the pathophysiology that we all take for granted, because we know this stuff. So we need to go back to our roots and try to understand why people don't understand the information we're trying to give them. And really increase your awareness. And if you want, get involved. We need your help online, everybody. And ultimately, we need to change this dynamic again and get into more of a partnership. And what I'll leave you with is, I always like to try to give book recommendations. These are 4 books that have changed the way I handle all of this. The Irrational Ape is a deep dive into cognitive bias and flawed logic and how people make decisions. Paul Offit, he's given us his blueprint. He's been fighting anti-vaccine campaigns for decades, and he has published several books that have shown all of us how we can fight back, including the mistakes that he made along the way. The Death of Expertise really talks about why we are no longer valued as experts in society. There's a lot of reasons here, and there's a lot into it. And the one I just recently read is the last one here. And it's talking about, it's sort of like the Irrational Ape of how skepticism is really influencing why people would ignore data and evidence and things like that. And with that, I'm going to stop sharing my screen, but I can't thank you enough for the kind invitation to be here. And I'm happy to take any questions.
No, this was fantastic. So we do have a couple of questions and comments, and I think we have time to go through them. So I'll read the first one. It's more of a comment, I think, than a question. This person says, our ability to develop a therapeutic relationship with patients depends on communication skills. Listening to patients using language they can understand and asking them to repeat back the information. This takes time, which is usually not reimbursed, yet it's the only way to convey information that can help patients make the best choices for themselves. In other words, we'd love to have these discussions that it takes, but don't have time. This comes down to changing both our communication skills and reimbursement policies.
Well, I agree. If I may, it takes practice too. I practice this routinely. We need to get good at our spiels. We need to anticipate. We can head it off. And but ultimately though, thinking about what are we trying to do here? You can be the smartest person in the world. You can take 20 minutes to explain the complicated pathophysiology surrounding your patient's condition and walk them through everything. But if they walk out the door and they actually go home and they can't implement what you actually talked about because their crazy life, I'm sorry, not crazy life, but their busy life, crazy busy life, and they have to pay the bills, they're out of a job, and they have their stressors and things like that, then whatever you spent time discussing isn't going to matter anyways. So we need to meet them where they are and take that time and help them with practical ways that they can improve their health.
Indeed. So a question here about hydroxychloroquine. Are the hydroxychloroquine outcomes based on randomized controlled trials done in outpatients with COVID? Or is the outpatient data simply extrapolated from inpatient trials? I don't think we have anyone on the panel who's a COVID-19 expert, but I do believe these were mostly inpatient trials. Is that?
That's my understanding as well. Yeah, the randomized ones especially. Yeah, I think that there are some observation studies looking at both use as prevention, and then
there's no data at all that's good data that shows that it makes any difference in my view.
I agree.
Right. And then Allison Ramsey, who I think says hi. Says one big issue I find appalling and challenging is when actual MDs and DOs spout consistently false information about vaccines, COVID, oils, alternative treatments, nutrition, leaky guts, etc. What are your strategies for combating these quote experts?
Thanks, Allison. I've tried a few different strategies. Sometimes it's people like a good fight. So sometimes if it's online, I'll take them on directly and just try to break it down into basics. But we need to also recognize the common tactics that people will use. So we have, straw man effect, and we have ad hominem attacks, and we don't need to get muddy in the mud with that. So I would avoid any personal, attacks. Or you just combat with information. And then if we can learn how to communicate effectively in ways that people understand, and this is what Twitter has taught me. If I can communicate complicated medical information in 280 characters, that means I understand the information pretty darn well, especially if I get the feedback that people then understand it and they say things like, oh, I've never understood it that way. So that's how we do it. We just reach people where they are one at a time. We can't control what other people are doing. You control what you can control, and we can control our response. We can control our efforts to combat it. And it just takes a lot of work. I agree.
We do as a medical community need to stick to facts, because if within us there are a few people who sign on to those false news stories and start propagating them, then it does become hard to control, because then it's one doctor against another. Mm-hmm. Here's an anonymous one that says, how do you speak with patients about the Lancet, respected medical journals, pulling articles from its publications due to questionable practices?
I love that question. Thank you for asking it. I think honesty is good. When was the last time anybody listening said to a patient, looked them in the eye and said, I don't know. I don't know the answer to that. I think we need to do more of that. And I think we need to acknowledge it. And then, so for things like that, we can say, listen, we're seeing things unfold in real time. Things are being rushed. And the fact that they are being retracted doesn't mean that we can't necessarily trust science in general, but it means we do need to, be diligent and look at the body of evidence. No single study really should ever drive everything that we do. But how does that fit into the body of evidence? But yeah, it's a hard conversation.
And then Dr. Verghese asks, how do you argue with someone who says the alternative, like homeopathy, has no studies to say it's useful, but at the same time, there's no data that it's harmful? So why not try it? It satisfies the patient.
Yeah, I agree. I don't argue with anybody. I really don't. And when patients come to me, so if somebody's in my office and they say, oh, I'm pursuing these alternative methods, I'll just flat out say, okay, I appreciate you bringing that up, and I'm happy to discuss that with you if you'd like. But let me ask you, why did you come see me today? Because, do you understand that my training and background is very different? And I like to try to, have conversations with families based in evidence. My understanding of these issues is that there's not much evidence to support their benefit. So where are they coming from? Why do they come see me if they're already doing these things? And then use that as a launching pad to have different conversations. But ultimately, I do tell a lot of families, I say, listen, you're right. What you're doing there is probably not that harmful. Let me know how it goes and we can learn from it together. But if you're not getting, but I also say, be as objective as you can, because a lot of these things are subjective in nature. And I say, pick 2 to 4 weeks, be objective, try to get third parties to actually observe, was there a change that occurred? And so figure that out now before you pursue it, and then reevaluate it and see if it actually helped.
Yeah, I mean, I think the worst thing you can do is just poo-poo an idea and not listen, because then the patient thinks you're just not, you're blowing them off. You're not.
Yeah, absolutely. And the other thing we all know is for a lot of the things that we see in the office, they just naturally get better over time anyways. So sometimes it's just a matter of tincture of time and not doing harm in the meantime.
Yeah. So Dr. Charitz asks, when you see patients arguing for treatments when you see physicians arguing for treating patients with ivermectin, et cetera, how do you respond to patients who say, well, physicians are recommending this too?
Yeah, I think that these are hard times and we need to stand firm and just be very direct. And, it's going to be hard. I don't have an easy answer to this. It may boil down to, this is the way that I practice medicine. I haven't seen any evidence that shows any benefit. There are potential harms from it as well. I'm not personally going to prescribe it to you. An example, in July, I wrote a policy for our division of allergy and immunology that we are not going to give any medical exemptions for face masks to any of our patients, because we were getting the calls left and right. We also knew that a mask is not a contraindication for anybody with asthma. That's what we deal with. We have thousands of patients with asthma. So we put the policy in place that protected our nurses, that protected our front office staff, that protected all of us. Because now we could say, here's the policy. And then people, if they get upset, they can go elsewhere. So that's one approach to take as well. But this will be individualized, of course.
I think we've gone through all the questions there. That was fantastic. Thank you so much. And a shame that we couldn't do this in person. Maybe next time.
I would love that. Thank you very much for the invitation. It was an absolute pleasure to be here today.
All right. Thank you very much. With that, I'm going to stop the recording here.